Ready? Good afternoon, everyone. I'm Dr. Mark Wilson. I'm the County Health Officer for Jefferson County. I'm here today to talk to you about COVID-19, to give you a few updates. COVID-19 continues to be in the news, and within the past few weeks, cases have been detected now in Florida, Georgia, Louisiana, Mississippi, and Tennessee. So as you can see, these are all areas that are surrounding Alabama. We know in Georgia, one of the cases was actually fairly close to the border of Alabama. Furthermore, in the United States as a whole, we've already had 1,323 cases with 19 deaths. Worldwide, we've had over 127,000 cases with 4,700 deaths. With this in mind, as you've probably heard over and over again, public health officials have been recommending measures such as increased hand washing with soap and water, or alcohol-based gels with at least 60% alcohol, increased environmental surface cleaning with common disinfectants, and asking that people stay at home when they're sick to prevent the spread of disease. COVID-19 is known to cause more severe disease in up to 20% of the population. It has a more profound effect on older adults and those with chronic medical conditions such as chronic lung disease, heart disease, diabetes, or in people who have an impaired immune system for whatever reason. I would point out that Jefferson County has a large number of people with chronic diseases. The good news is that the vast majority of people do not get severe illness, and they recover fully. Children in particular are very unlikely to get severely ill, so we're grateful for that. But here's the rub. Children can get infected and spread it to other people. And children and others may have only mild symptoms or lack any noticeable symptoms at all. So you can see how the disease can spread in our community without people necessarily knowing that they've been exposed. Jefferson County, like many other places in the United States, is very likely on the verge of detecting a case of COVID-19. It is our belief that there's a very good chance that there are cases already present in our local community. Up until this week, testing for COVID-19 in Jefferson County and throughout Alabama has been limited to people meeting very stringent criteria. So last update I got through the state lab, we've tested less than 50 people. I'm not criticizing any of those efforts. I think the state has done a very good job doing the best they can to get the lab set up. We're also grateful that commercial labs have come online now to make testing more widely available. But with all these factors in mind, the Jefferson County Department of Health is now recommending that public gatherings with more than 500 people be canceled until further notice. This recommendation is meant to decrease large gatherings of people where respiratory viruses can spread easily to a large number of people. While this may represent challenges, and we realize that it does, we know that this creates hardships, we feel that this is a prudent step to protect our community by decreasing the chances of spread of COVID-19 or any other respiratory viruses. I mention other respiratory viruses because influenza is still very prevalent locally. Influenza is keeping our hospitals and our healthcare system busy right now and using up resources. So get your flu shot if you haven't had your flu shot yet, please. Furthermore, all of the disease floating around and any additional cases we might get on COVID-19 will have an important impact on our hospital systems. So what we're trying to do is reduce the number of possible cases in order to prevent overburdening our hospital systems, so that if and when we get cases, they will be able to provide the medical care that's needed. I want to point out that our recommendation today here for Jefferson County does not necessarily have implications for the rest of the state. Other parts of Alabama may choose to make different recommendations based on their own risk assessment. I'm responsible for Jefferson County. I would argue that Jefferson County has some increased risk of having cases of COVID-19 and spread of COVID-19 due to our population, just the overall number of people, our interstate traffic, the fact that we have an airport here that has a fair amount of traffic coming from other large cities and hubs, including Atlanta, where we have known cases, our international universities, etc. So these factors all have played into this decision. So 500 is not a magic number. We chose that number as what we think is very reasonable for this particular time. But keep in mind that for gatherings of less than 500, we really want people to be very careful. There's some factors to consider. How many people are overall at risk of exposure? How closely crowded might they be in a given situation? So I want to just point out, the magic number is actually 6 feet. That's what expert opinion, the CDC, has recommended as the sort of safe distance for what we call social distancing. So in any given situation for our public, we want them to think whether their event is 20 people, 50 people, 200 people, to think about trying to increase the social distancing to get that 6 feet. You could have an event with 20 people where it's extremely crowded, with vulnerable people attending, that could be more dangerous than an event with 200 people, people at less risk who are more spread out in whatever given situation that is. I want to just point out specifically, just before there are any questions, there are some schools that may have more than 500 people. We are not saying that schools need to close, and I'm referring to our local schools. I want to make a special mention about people who are 60 years old and over, and people with chronic medical conditions. We advise that all people in that situation take everyday precautions to keep space between themselves and others as much as they reasonably can. When they go out in the public, keep away from others who are sick, limit close contact, and wash their hands often. For example, if someone needs to go to the grocery store, perhaps pick a time when the grocery store is less crowded. So I just also would advise those people to avoid certainly cruise travel and non-essential aircraft travel. These are unprecedented times in Jefferson County and in the United States, at least going back to the great flu epidemic of 1918. So we are needing to take unprecedented action at this time. We'll continue to monitor the situation and we'll provide further guidance as we go along. We may change our recommendation depending on the situation day by day. And we will make every effort to remain in touch with the media, the public, and our partners in the community. So the main thing I want to reiterate before I close my remarks is that we are making a recommendation effective immediately that gatherings, public gatherings of greater than 500 people be canceled until further notice. I also have with me, let me find it, a draft of an actual order that I can use and will use if I need to. Alabama Code 22-3-5 authorizes the county health officer to institute immediate measures to prevent the spread of notifiable diseases that are seen to be a threat to the public health. So I do have the authority to actually issue an order for events to be shut down if necessary. We are not doing that at this point. We are offering recommendations and hope that people will make good judgments and suspend other considerations with a priority for people's health and protecting people's lives in our community. I would also just say to each individual in our community, I encourage you to think about not only your own safety and your own health, but think about your neighbors and how you might protect them by being responsible to keep those vulnerable people in our community from being exposed and endangered by this potentially dangerous disease. So I have my team here, Dr. Williford, Dr. Hicks, and Stephanie Ayers-Millsap, who are going to also make just a few comments. Dr. Williford?
Hello, my name is Wesley Williford. That's W-E-S-L-E-Y, Williford, W-I-L-L-E-F-O-R-D. I'm the Medical Director of Disease Control here at the Jefferson County Department of Health. Just to kind of say a couple other things off of what Dr. Wilson said, one of the things I would like to keep in consideration is the reason for measures such as this has to do with the nature of how viruses are transmitted, particularly respiratory viruses. Unfortunately, with the respiratory viruses such as COVID-19 or influenza, the spread occurs through the projection of droplets into the air. Those droplets are what contain the virus and what causes someone else to come in contact with the disease and catch whatever virus we're talking about. These measures are meant to reduce the number of opportunities where that can happen. If we can cut down on the number of times that a person can come into contact with the disease or virus, we can hopefully decrease the number of cases that we would see in the future. The other thing, again, I cannot reiterate enough how important it is that we engage in these community measures of really encouraging good hand washing, good cleaning on commonly used surfaces, and making sure that we're trying our best to keep our distance in our day-to-day lives for the next little bit. You know, I also want to say it's very important to think about people who are more vulnerable, the group of people that we are concerned about, and we want to look out for their health. But I think also we have to make a call to community to say, you know, if you have neighbors, if you have people who might need assistance, take a moment to offer that assistance. Take a moment to look out for your loved ones. Take a moment to look out for anyone that you may know, and let's work together as a community that we can get through this sort of difficult and scary time for some people. The other thing, lastly, I kind of want to say again, I can't encourage this enough, but I know we say it till we're blue in the face, but I cannot express enough how important the flu shot is at this point in the year. We still continue to see very high levels of influenza within Jefferson County and within the state of Alabama. Again, a flu shot is not going to protect you against coronavirus or COVID-19. However, it can protect you against the flu. It can decrease hospitalizations due to the flu and decrease visits to the doctor. And that's one of the most important things that we can do right now, is to avoid overburdening our healthcare system. So, you know, I can't tell you enough how important that is. So with that, you know, again, I just want to really reiterate, flu shot, make sure that you're looking out for your neighbors and helping out anyone who you can help out, and just make sure that we work through this as a community. Thank you.
Good afternoon. My name is Dr. David Hicks, D-A-V-I-D-H-I-C-K-S. I serve in the capacity as the Deputy Health Officer here at the Jefferson County Department of Health. I also serve in the capacity as the Incident Commander for our COVID-19 response here for the Health Department. I want to just let you know about some of the preparedness measures that we've taken. Here at the Health Department, we have implemented our Incident Command structure. That is a structure that we have in place where if there is any emergent incident that we have to deal with, we have a formalized structure and process in place for proper planning and preparedness. So we have teams that do planning, operational, logistical, and administrative support, and we've been doing this for the past several weeks. We are confident that the steps that we have taken internally and with our partners is fully preparing our community to be adequately prepared for any threat or risk. We also are in close collaboration with our community partners. We actively participate with our Healthcare Coalition, which is a collection of over 100 organizations throughout the public health landscape that we are in close contact with to help them prepare for any responses. We deeply appreciate our hospital partners and also James Coker from the EMA for their leadership and active support. So as we have been preparing, we have also been preparing our community. We have had several meetings with school officials, individuals at the airport, city officials, the court systems, universities, and anyone else that has called to get consultation and guidance from the public health department. We also remain in active communication with the Alabama Department of Public Health and the Centers for Disease Control and Prevention. We will keep you abreast of any changes. As far as general preparedness, and you've heard this in the past, generally for the community, in addition to the social distancing, we encourage proper hand washing technique. Use soap and water. We know that there has been concerns about running out of supplies as far as hand gels with hand sanitizers, but you can use soap and water. You know, if you have the proper concentrated hand gels, we encourage using those, the social distancing, and cough etiquette. These are things that we've been taught for years, but when we cough, we want to cough right here and into our elbows, not into our hands. We don't want to touch our faces because we don't want to have the risk of spreading these droplets anywhere. So these are those kind of common sense measures, and we need to then look out for all of those vulnerable individuals in our communities as well. And so your friends and family, your coworkers, if they need assistance or extra guidance, let them know. We're not in a state of panic. We at the Public Health Department are fully prepared, and we are looking forward to continued work with our partners. Thank you.
Hi, my name is Stephanie, S-T-E-P-H-A-N-I-E, Ayers, A-Y-E-R-S, Millsap, M-I-L-L-S-A-P. I am the program manager for our prevention and epidemiology program. This is the program which follow up on diseases such as this. Our staff is responsible for communicating mainly with the public and with the community. We deal with the schools, we deal with the medical providers, we also deal with long-term care facilities as well as the general public. We answer questions and make sure that they have the current guidance as well as recommendations from our state health department as well as those guidance that are recommended from the CDC.
This time we'll take a few questions. If you have questions, members of the media, please just fire your question off and the appropriate person will come to the mic.
Where do you recommend people go if they want to get tested?
Testing has been something that's caused a bit of confusion over the past couple of weeks. And what we would say right now, the way the process works, there's a couple of different options. So the first option is that when a person seeks care from their physician or nurse practitioner or provider, that the person, if they wish to access testing from the Alabama Department of Public Health, they will utilize an online person under investigation form, and the provider will need to speak with the state health department about that testing and how to facilitate it. The other option is that some private labs have begun to offer the testing. So that has become available. So private physicians should be able to access that testing as well. So really it's going to end up being a conversation with a person's physician and then potentially either a private lab or the Alabama Department of Public Health.
Do you expect there to be an easier way for more people to get tested?
We hope to continue to see capacity improving. I think with some private labs going online, I think that is going to relieve some of the burden of getting tested. But I think that's still something that's going to be in flux for a little while.
Does the health department have the necessary, tools to collect these specimens?
So at the moment, the health department, we are not actively collecting the samples here. We're beginning to gear up to be able to do that, but that's something that is going, we're sort of limiting at this point because we're trying to get everything up to where it needs to be.
And can people get tested by their local doctors?
Yes, they most certainly can get tested by their local doctors. I would advise that people call ahead to their local physician prior to this so that preparations can be made to do that. But the physician should have access to whichever private lab that they contract with or work with. A lot of the large lab providers are beginning to do that. Or they can contact the Alabama Department of Public Health for guidance on how to utilize their testing.
And that specimen will come back to you all?
So in a roundabout way, we would be ultimately notified of it, but the provider, if they ordered it through the state, they would be notified too, but we would be as well.
Dr. Wilson, you said Jefferson County is very likely on the verge of detecting a case. Can you elaborate on why you say that?
Yeah, and I may ask Dr. Williford to elaborate on that as well. So the fact is that there's just so much already in our country, and there is a great deal of travel, and we've had experience from other places where it's popped up unexpected. So in the fact that we are seeing cases in surrounding states, we just think it's likely, sort of a common sense, knowing how disease spreads, that we need to assume that it is in our community. We do not know that for a fact. I cannot prove that. What I'm saying is that those of us that work in this area and some of our friends in infectious disease and epidemiology are all sort of nodding their head and saying, yeah, it's probably here.
And you said about 50 tests have been made across the state of Alabama. Did I hear that right?
That's just was the last I was told as of yesterday. Somewhere just shy of 50 tests have been conducted by the state lab that's set up by the Alabama State Public Health, the Alabama Department of Public Health.
How does that compare to other states?
I don't have those numbers. I don't know if Dr. Williford might, but you know, as you know, in the general news media, that there have been some issues with delaying getting some of these tests set up and that sort of thing. But Alabama started offering it through the state lab last week. Prior to that, there was still testing available at the CDC, where specimens were being collected, sent through the state lab to the CDC. So testing has been going on for a while. It's just been fairly restricted. I do want to add one little caveat, I think, just to what Dr. Williford just said about labs and private doctors. We are not telling you to all go run to your private doctor's office to get tested. We're going to have to still be very, very judicious in terms of whom gets tested, and people that are not severely ill. It will be very likely that somebody's going to just tell you to stay home. We're trying to use common sense to try to keep this under control. The other thing is, I think just in reality, it may still take a little while for some doctors' offices to get up and going to where they're able to do the testing. There are some concerns in terms of how many doctors' offices have enough protective equipment to have people in their office who are actively ill. Those are in limited supply. I'm talking about the face masks, the face shields, things like that. So there are some concerns about that, and I don't want to be too, just say, oh, everybody's ready to do a test on you right now. And because the commercial labs are just the beginning of this week said, okay, we can start doing testing. So it's brand new to us, and so just keep that in mind.
Dr. Wilson, your suggestions of cancellations of public gatherings, how would you differentiate public gathering from a church service?
We actually would consider a church service a public gathering, and we know that that has a big impact because we have some big churches in our community, but there's nothing inherently different about a church gathering and some other public gathering in terms of the disease spread. So we would, and we know again that that's going to be a hardship for people. We realize that. I might be a little unpopular for making this recommendation. So I think there are certainly some things that we want people to think about. Can they have an extra service to spread people out? those vulnerable people we were talking about, folks that are older, folks that have chronic diseases. If you're going to a really big church, there's a good likelihood that that church is offering their services online or a recording of those services. And now might be a good time to participate in the church service from home if you're one of those vulnerable folks. So I think each church is going to have to make their own decision on how they handle that, but we really do want them thinking carefully about it. I go to church myself. Our church just recently made some changes, some recommendations, and we all really believe that one of our biggest responsibilities is to love our neighbor, and that means protecting those in our congregation especially. So they need to take steps to do that.
And with those, the vulnerable type, wouldn't children be considered more vulnerable? So why not suggest cancellations of, I guess, schools as well?
Yeah, you know, ordinarily we think of children being vulnerable, and that's true for some diseases. And for some reason that's not fully understood, children do not seem to be very vulnerable to COVID-19. And again, that's great news. That is really great news. So we're not expecting to see a lot of children getting seriously ill or having a life-threatening illness from this. They may have a very mild illness or virtually no symptoms. But again, I want to reiterate, and I don't want anybody to be misled to think that children cannot get infected. Okay, children can get infected and children can spread disease. So that's where we just have to be careful, and that gets to where we think about those measures like in a Sunday school class or a school classroom where you have people coming in close contact with each other, making sure that environment is kept clean, the surfaces are kept clean. Those children are very good at spreading diseases. You know, there's a lot of contact that goes on.
Other than church services, what other events with more than 500 people expected are you expecting in Jefferson County over the next weeks and months? Are there any that you know of?
I don't have an exact number, but yes, I'm aware of some events that are planned for even this weekend. There were a couple of events at the VJCC that I heard were voluntarily canceled. There's a track and field event out at the Crossplex. We've been in touch with them. That's an NCAA Division II event, and they're making some changes accordingly. But I keep hearing about new ones, and again, that's one reason why we are here today talking to you now. We had some discussions about, is now the right time to say this? Should we wait? Should we wait until we have actual confirmed cases? And we just were not comfortable with that, because we have been hearing about a lot of events where people are coming from all over the country, gatherings of 1,000, 2,000 people. We think now is the time to be really proactive and try to protect the citizens of our county from the potential that they'll be exposed to COVID-19.
Okay, we got time for about one more question.
Do you think that the schools, I know you said they're open right now, do you think there will come a point in time where you'll suggest they close? I know some schools like in Georgia have closed indefinitely until.
Yeah, and to reiterate, we did have a meeting in this very room, what was it, 10 days ago maybe? With the leaders of all the schools, public and private in Jefferson County. Very good meeting. So we've been talking with them just how to make the common sense preparations that we've already talked about, you know, the sanitation, all that sort of thing. But whether to close a school or not is going to be on a case-by-case basis and based on a very specific situation. So at this point, we don't anticipate doing that, but we don't know what the future holds. Those places where schools have been closed, there has been a very specific reason for doing that, not just a general blanket sort of thing like we were saying today with these larger gatherings, which are more optional type gatherings. You know, in public health, we have to balance all these things. And in public health, we are very concerned about diseases, infectious diseases, and that's sort of the bread and butter public health that people think about. But public health is also making sure that children get a good education and that they get off to a good start in life. So we want to, if at all possible, make it so that children can continue to get what they need but at the same time, we're gonna have to take precautions, and at some point, we might have to pull the plug on something in order to just protect people from disease.
And my final question, how are you and your team preparing
Oh.
for what may or may not happen?
Yeah, I think Dr. Hicks went over a lot of that. We are in what's called incident command, which is a very structured process that's used across the country in multiple organizations for emergency planning. These are things that we've rehearsed for, flu pandemic type situations. So we have a system in place for doing that. A lot of the planning has been preparing our own organization, making sure that we know what to do if our staff gets sick, or if we have to have people work from home, things like that. We've been advising other businesses on how to make their own plan. As I said, schools to make their own plan. We're in touch with our healthcare coalition, multiple healthcare partners, sharing information, talking about how do we plan, in conversations with the local hospitals. So the list goes on and on about just planning, getting ready, and that sort of thing. Now we're more in a situation where we're talking about, how do we think about handling positive cases? The whole testing conversation is going on, things like that. So stay tuned for more. We'll keep you informed as we go along. We want the public to know what's going on. We don't want to scare people. We also don't want people to be complacent and say, oh, this is no big deal. It's not going to happen to me. It's not going to happen to us. What our goal is to really be very, very honest with people and tell people what we know and what we don't know, okay? There's a lot we do know, and there's some things we don't know, and we just want to be transparent about that. So thank you, everybody. Appreciate you coming.